Namaste students, Hamesha खुश रहो बिटिया. I am JV'n's Dr. Neeraj Dholia, Faculty of Agriculture and Veterinary Science, Jayoti Vidhyapeeth, Women's University, Jaipur. So today we will discuss the topic, the communicable and non-communicable disease, diagnosis and prevention of AIDS. So in the previous lecture we have discussed the sign and symptoms of the AIDS, and this topic comes under the subject medical biotechnology. So in the previous lecture, we have discussed that the AIDS is a chronic condition caused by the human immunodeficiency virus, HIV virus, and it actually damages the immune system, and it interfere with your ability to fight against the infections. So it is a STI and a sexually transmitted infection, and it also can be spread by the contact with infected blood and from mother to child during the pregnancy and childbirth or the breastfeeding. So the medications dramatically slow down the progression of the disease, but cannot completely um, recover the patient or heal the disease. So signs and symptoms includes the uh, phase of the infection. So what is the phase of the infection, which defines the signs and symptoms of the um, disease. So the primary infection um, include the fever, headache, muscle pain, rash, sore throat, and weight loss, cough, and night sweat. Okay, so the latent in the latent phase, it will not show the symptoms uh, for the disease, and the symptoms of HIV infection with the progressive disease include the sweat, chills, recurring fever, chronic diarrhea, swelling lymph nodes, white spot on the tongue, and weakness, weight loss, rashes, lumps, etc. So let's talk about the diagnosis. So there are various types of the diagnosis for the disease, like the antigen antibody test, the antibody test, the nucleic acid test. So let's talk about the antigen antibody test. So the antigens are collected from the blood, and the positive test for the antigen in the blood may take a few weeks after the exposure to the virus. Likewise, the antibody also isolated from the blood, and it takes weeks to months to become the detectable. So the combination of antigen and antibody test can take uh, 2 to 6 weeks after the exposure to become the positive if the virus is there. Again, the diagnosis technique is the antibody test. So for the antibody test, the sample can be taken from the blood or the saliva. So the most rapid HIV tests are also there in the antibody test. So they are the uh, enhanced test, and they can take 3 to 12 weeks after the exposure of the virus. Okay, so the third diagnosis test is the nucleic acid test. So actually, the nucleic acid test is the viral load test. Means you can actually um, uh, see the virus, means actual virus in your blood. No antigen, no antibody, no any protein. So virus in the nucleic acid test, you taste the actual viruses present in your blood. So for this test, the sample is the blood. So blood is taken, and the nucleic acid test will be performed. So thank you. Hope you are satisfied with this digital session, and if you have any query, please write in the comment box. And this digital session is powered by digital version 2, Jyoti Vidhyapeeth Women's University, Jaipur. Thank you.